So now we have to proceed ahead. And we will be discussing about the remaining endocrine glands, right? Till now, everything is clear. अभी तक जो समझा है वो क्लियर है? Okay.
Yes, sir.
Good, very good. So before,
Sir, I want to ask you something.
yeah,
So if supposing left leg is paining, the whole leg, so we have to use UV-62. On which side we have to do? Single point if I want to do.
if the left leg is paining, whether if the left leg is paining, we have to take urinary bladder 62 on the dominant side.
Dominant side. Tone we have to do or even method, sir?
So we have to do tonification.
Only one point.
Tonification of the master point and sedation of the couple point.
Oh,
This is the concept number one. The concept number two, in the future, you will be learning. Suppose some person is suffering with the left leg pain, like you told. You told left leg pain, right? Suppose just imagine person is having left leg pain. Body is very cold. Person is having yang deficiency. Body is very cold. Okay, even swelling is there. So person is having pure yang deficiency. Then we will be doing the tonification of UV-62, even tonification of SI3. We will improve everything.
so even swelling will also go away from that?
Yeah, definitely. Yes, definitely.
On both the sides we have to do?
One person came to me with the lower back pain. He told me that, can you treat the lower back pain? I told yes. Okay, tell me what's your problem. Oh, I'm suffering with the lower back pain. Even my left knee is paining. Okay. What else? Oh, when there is a cold, my pain is getting aggravated. Okay. ठंड से दर्द बढ़ता है, right? Person is getting more pain in the winter season. And there is a little swelling and the pitting edema in the leg. Okay. So the person was having all the sign of yang deficiency. Swelling, lower back pain, and even the knee pain. So what we did, we just took urinary bladder 62 and SI3 bilateral tonification. That concept will come after certain number of classes. Right? You will learn that concept. And you will get surprised. I just put the magnet SI3, UV-62, UV-62. After 10 minutes, I asked her, how are you feeling? He's telling, I'm feeling much better. My pain is not there right now. So in this way, these points working, right? So right now, like you asked whether we have to tonify the master point, yes, definitely. But sometimes, if the person is very low, very weak, maybe very old person, or person is suffering with a low blood pressure, sometimes we don't sedate the couple point. Right? We have to be very careful for that. So this is a very general concept of tonification of the master point, sedation of the couple point. But slowly we can learn, because it's very difficult that we learn everything in one point, right? As a one movement. At one moment, we can't learn all things. But slowly, definitely we'll learn. Okay, sometimes we have to tonify SI3, UV-62, bilateral tonification. वो भी हम देखें कि दोनों तरफ tonification करना. Right now, we have to understand this concept that tonify the master point on the dominant side and sedate the couple point on other side. For example, it's a very wonderful, because this is very wonderful chart, I will show you once again. And after that, if you have any question, please ask me, because I think you should always use this chart. Let's see this chart. Always remember this chart. Person is suffering with the heart attack or the chest pain. Spleen for tonification on the master side and pericardium sedation on the other side. You will see the effect within friction of minutes or less than 1 minute. कि एक व्यक्ति को हार्ट की प्रॉब्लम हो रही है, एक व्यक्ति को चेस्ट में पेन हो रहा है, spleen 4 and the pericardium 6 combination, one of the great combination. Now, person is suffering with a diarrhea, stomach issue. Spleen 4 tonification, pericardium 6 sedation. I will tell you, I am having clinic in Vadodara, and there is one company above my clinic on the 3rd floor, the big company, like we have running like corporate company. Anyone is suffering with a diarrhea, they run to me. They are rushing to me. And my first treatment, spleen for tonification, pericardium 6 sedation. As soon as I do this, they start feeling something happening good. Then I do moxibustion around the navel. फिर नाभि के आसपास हम moxibustion करते हैं. We know that moxibustion also very wonderful, right? इतना करने मात्र से patient ठीक हो जाता है. My favorite treatment, I will tell you, I will write here. So anyone coming to you, you can always apply this with 100% result, with 100% confidence that person will be getting cure in the diarrhea.
So which side of
Spleen for tonification, pericardium 6 sedation. Spleen 4 will be on the master side, means master point will be on dominant side, and the pericardium 6 sedation will be on the other side. And moxibustion around navel. नाभि के आसपास moxibustion कर दीजिए. So if this is the navel, near about 1 inch all around, you can do the moxibustion. Spend at least 5 to 10 minutes for moxibustion. Or you can use moxa stand, or you can do ginger moxa. That depends on you, what you like.
So if we are traveling and if we don't have needles,
So
and if some
I will tell you,
person is suffering from diarrhea.
Yeah, I will tell you, I was traveling once. One person was suffering, and during my travel, one person, I found out this person is having some problem. Like he was rushing again. I was having moxa stick. I was having only moxa stick with me. So what I did, I told, okay, do the acupressure on the spleen 4 bilateral, do the acupressure on the pericardium 6 bilateral, do yourself. Okay. And I did just moxibustion around the navel. Done, over. Right? So,
सर ये moxibustion around navel करने का टाइम sand और salt डालने की जरूरत नहीं है navel के
simple,
ऊपर.
just do the, आप moxibustion को हाथ में लेके ऐसे से कर दो.
Cigar moxa.
Yeah, there are many ways of moxa, like in the traveling, it's not needed. Even I will tell you, once I was traveling and I was feeling too hot, so I slept on the floor. मैं धरती पर सो गया. And we know in the acupuncture it's very clearly mentioned, if you are sleeping on the floor, sometimes there is an attack of dampness. है ना, कहते हैं धरती पे नहीं सोना चाहिए, आसन बिछा के खाना खाना चाहिए, और ऐसे मतलब आप नीचे बैठो तो कुछ बिछा के बैठना चाहिए, राइट? इवन खाना खाते समय कहते हैं कुछ बिछा, आसन बिछाओ. Why? Because there might be attack of dampness. Okay, maybe every person will not get, but some person might get. So if there is an attack of dampness, then I start getting diarrhea. I did moxibustion immediately because I understood now there is an attack. Yeah, gone. Because then I drive the car 200 kilometers after that because we were going for temple. Suppose I am going for temple, in that route I am getting diarrhea, then it is very difficult. I didn't get a single motion after that, just after one moxibustion. So I spent 10 minutes for moxibustion. And so spleen 4 pericardium 6 is very effective with this, right? In this way. we can do. It's
Sir,
clear?
this treatment is diarrhea due to heat also is different, no, sir. So for that also, can we use the same treatment, sir?
Yeah, actually, it's a very clearly mentioned in the EOB. If you want to use Chongmu means spleen for heart, chest, and stomach. Whatever the problem of the heart, chest pain, angina, heart attack, high blood pressure. I given the example a few
No,
days.
sir, the same diarrhea due to heat I'm asking you. Because diarrhea is due to.
Whatever the reason.
And regarding this ginger moxa, how to give the ginger moxa, sir?
No, you are
No.
asking. No. I'm telling
Coming.
if due to the if suppose
What
I'm telling. See, if I mute everyone, then you will not able to ask the question. So please, if you are speaking in your home, so please mute yourself. Okay. Suppose we can use always spleen 4 and pericardium 6. Always. But whether this is due to the cold attack or the heat attack, but regarding the moxibustion, there is a rule. What is the rule? Moxibustion we can't use if there is a infection or heat. Means infection we can use, but if you have someone is having some excessive heat in the body, like having fever or bleeding, then we can't use moxibustion. Moxibustion is preferably we are using in the cold condition and in the normal condition also. But if you are asking about the heat, like you asked, can we use moxibustion in the heat? What type of heat you are asking? Whether it's in some.
Due to the climate, maybe due to the climate, too much of heat, this thing, stomach heat, or any.
Like how means what is the symptoms? What are the symptoms?
सनस्ट्रोक में भी बहुत बार डायरिया होता है सर.
Yeah, so we have to be careful. If there is something like a heat, then we have to be very much careful because moxibustion is not contraindicated in the heat condition, in the feverish condition. Then we can go for a spleen for pericardium 6, right? Spleen
Yes,
for,
sir.
then we can use this protocol. I will tell you.
Sir, ginger moxa, how to give, sir? Ginger moxa?
Okay, wait for a minute. I will tell you.
Yeah.
Suppose someone is suffering with a diarrhea.
So can we use Sujok points on hand? SP4?
Whether you use Sujok or the body points, both working very nicely.
This can be used for IBD also.
1 minute. So suppose someone is suffering with the diarrhea, whether because of the heat condition or because of the cold condition, we can always use spleen 4 as a master point, pericardium 6 as a couple point. Then we can add the moxibustion if there is a cold condition, right? But we can't use the moxibustion if there is a heat condition. But in both conditions, we can use one very effective protocol: spleen 4 tonification, pericardium 6 sedation, stomach 36, stomach 43, even method. It's a very effective protocol, and we can use stomach 36 and 43 on the left side. Okay, so we can use these points. So now these points will be taking care whether the diarrhea because of the heat condition or the cold condition. Okay, we can work on that.
And IBD also.
Like IBD also, definitely. For irritable bowel syndrome, also we can use it. Okay.
Okay, thank you.
Okay.
In one lecture,
Yeah,
front side of the body, left side we have taken LU7.
that will
And in second, this thing we have taken on the right side LU7. Why?
actually, see, right now we have just started, and even our class we have just started, so we will discuss everything. Like we have to discuss a lot about the ren, my, do my, chong my, everything, right? So don't worry, for that we will discuss that thing. I understood your point.
Okay,
That
because I was a bit confused. It's
then
left
someone
side,
will-
then side, right side. So I was a bit confused.
wait for a few days.
Okay, 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 sir.
That was
So,
when you used two
in
protocols
last
together.
lecture,
Yeah.
sir, in last
So,
lecture, you
so
said
sometimes,
for the
In last lecture.
so sometimes, yeah, the box are
anterior
still so
pituitary, you said that we have to apply lung 7 and K6, and intermediate pituitary is used for melatonin. That is for melatonin. It is
Melatonin.
hormones.
Yeah.
It is melatonin hormones, which is
melatonin.
for the leukoderma.
Okay, okay. Then, so what do you want to know?
Then even for black pigmentation, we can use that pigmentation.
Okay, so I will clarify you one thing first. Don't get confused here. See, this is the brain. In the brain, we have one pineal gland. Pineal gland is secreting one hormone that is called melatonin. Melatonin is the hormone who is getting secreted in the dark room during sleep. और we can tell it is getting secreted during the midnight. ये रात को secret होता है और इसका काम है relaxing the body and body, mind and nervous system. So this is melatonin. Now, the anterior pituitary, the pituitary gland is having three parts. Anterior pituitary, intermediate pituitary, and the posterior pituitary. Right? So anterior pituitary and the intermediate pituitary getting fused together and they are becoming one. Okay. So the points we are using, they will be working for both. So this is one group, anterior plus intermediate pituitary. The intermediate pituitary secreting hormone that is called MSH, melanocyte stimulating hormone. See, this is melanocyte and this is melatonin, both are different. So here is the melatonin, which is secreted by the pineal gland, and this is melanocyte who is making your skin black. जो आपकी स्किन को ब्लैक बनाता है वो है मेलेनोसाइट, मेलेनिन, चमड़ी को काला बनाने वाला जो पिगमेंट है वो है मेलेनिन, और जो जिन सेल से निकलता है उन्हें कहते हैं मेलेनोसाइट, और मेलेटोनिन इज अलग. तो दोनों को आपस में मिक्स मत करिएगा क्योंकि दोनों एकदम अलग चीजें है ना. ओके, एनी क्वेश्चन?
Sir, what if, sir, when we are working on Chongmo, what if SP4 and P6 increases the blood pressure?
When we are working on the Chongmu, so
Yes.
the master point of Chongmu is spleen 4.
Yeah, but sir,
yeah, what?
so once I was working on the uterus, or I applied SP4 tonification and P6 sedation, so it directly shooted up the blood pressure. And then I removed it, then the blood pressure again came down.
Okay, so you put on which side?
For the female, on the right side SP4 and left side P6.
Okay, so after you put the point and the blood pressure goes up?
Yes.
Actually, I have applied spleen 4 and pericardium 6 for many patients. Generally, it's if the person is having high blood pressure, it reduces the blood pressure. Like I give an example, a patient was having blood pressure very high, 180 by 120, was having chest pain. And as soon as I applied spleen 4 and pericardium 6, immediately BP, see, I will tell you. So I will write here so you will understand. Then you correlate. But every patient is different. If it happens
Yes.
opposite way, then definitely you have to do the reassessment. See,
Okay.
here, spleen 4 is the master point, right?
Right.
So when we are using Chongmo, the meaning of Chongmo, we are tonifying the spleen 4 and we are doing sedation of the pericardium 6. So we can see here in this image, when we are using Chongmu, so spleen 4 is the master point and the pericardium 6 is the couple point. Generally, it reduces the blood pressure, reduces the BP, right?
Yes.
But if we do opposite, what opposite?
P6 tonification and
P6
SP4 sedation.
tonification and spleen 4 sedation, generally it is reducing, it is increasing the BP. So generally what's happening, suppose we will be discussing that thing later on. So person is suffering with a low BP. As soon as we tonify the pericardium 6 on the master side, and we can see it will raise BP. अगर हम pericardium 6 को master side में tonify कर दें, so pericardium 6 tonification on the master side and spleen 4 sedation on the couple side, means the dominant side pericardium 6 and other side. This is the couple point on the other side. So my question from you, you're telling about the one patient, right? What about the many other patients? If suppose you have treated 10 patients, right? Have you experienced the same thing with every patient? No,
No, sir.
What
No.
you experienced generally?
Generally, the BP stabilizes.
BP
If
is
the
So now in your case, if you're asking why it happened, right? Why it happened?
yes.
I'm applying the spleen 4 tonification and pericardium 6 sedation. हमने spleen 4 को tonify किया, pericardium 6 को sedate किया, BP कम होना चाहिए था, लेकिन उल्टा हो गया, BP बढ़ गया. ऐसा क्यों हो गया? मतलब it's as per theoretical explanation, it's not possible. As per, but
Right.
आपने देखा अपनी आंखों से ऐसा होता हुआ है ना? ऐसा क्यों?
Yes.
लगता है. So we will learn in the future, we will learn very shortly कि चोंगमो का जो दूसरा नाम है वो है अवरोध निवारक, रिमूविंग द ऑब्स्ट्रक्शन. मान लो एक नाली को बहुत धक्का लगा रहे हो फिर भी वो खुल नहीं रही है. इट माइट गेट सम प्रॉब्लम फॉर ए व्हाइल, इट माइट गेट सम प्रॉब्लम कि आप किसी नाली को खूब धक्का मार रहे हो. चोंगमो इज फुल्ली ब्लॉक्ड, मे बी the female were having some problem, Chongmo is fully blocked. It might happen sometime, right? But generally it will not happen. We have seen quick reduction in the blood pressure. Low BP patient को आपने pericardium 6 tonify किया है?
Yes.
बढ़ जाता है ना BP? रेज होता है ना?
Yes. हाँ.
सर अभी मेरे पास एक पेशेंट आए थे, उनका बीपी फ्लक्चुएट होता था, लाइक 260 भी हो जाता था और नीचे भी हो जाता था. तो मैंने उनको तभी हमने ये आपने ये बताया था SI3 UB62 और यहाँ वाला पॉइंट ये लगाने से सर क्या मस्त स्लोली उनका बीपी I don't know how, but मुझे उस वक्त वही पॉइंट उनके लिए सही लगे.
Very nice.
और बहुत अच्छा लगा.
Okay, sir. For such exceptional cases, can
one-
we do just
one
perpendicular even method?
the
Can we do?
situation-
That is good idea. Actually, I will
Yeah.
tell you, yeah, so that is good idea, doing the perpendicular.
Yes. Yes. Okay. Thank
Just
you.
by mistake, sometimes
ये
it
जो
happens.
आपने मिलेनियम साइट्स का जो बताया ना,
Not millennium, melanocyte.
So what if in
Melanin-
situation whereby you cannot access the
मेलेटोनिन और
moxastic?
मेलानोसाइट. सर तो ये जो पॉइंट है,
हाँ,
तो जो ये ब्लैकनेस जो करता है, तो जब ब्लैकनेस बढ़ता है तो भी यही पॉइंट आएंगे बिकॉज द लंग 7 एंड K6 किडनी 6.
देखो एक चीज बता रहा हूँ मैं आपको, इधर देखिए. Let's see. So this is the intermediate pituitary. Secreting MSH or melanocyte stimulating hormone. So this is secreted by the pituitary gland. Suppose pituitary gland is here, somewhere here. The anterior pituitary is secreting MSH. Now this MSH will come to skin. in each part of the body, हमारे शरीर के प्रत्येक भाग में जहां भी स्किन है वहां पर ये जाएगा, in every part of the skin. So suppose this is the skin. Skin is having many layers. In the skin there is one factory. There are many factories. So the name of these factory are melanocyte. So MSH will come means melanos, इसका नाम ही है the hormone who stimulate melanocyte. So melanocyte stimulate hormone will come here and this factory will start. ये factory start हो जाएगी and will start producing melanin. ये melanin का निर्माण करेगी जिससे स्किन होगी काली, black skin. It will make the skin black. Right? If we are stimulating, so in this way, if the intermediate pituitary is secreting more, that is not good, less, that is good. If we balance the intermediate pituitary, अगर हम इसे balance करते हैं, if we are applying the point of the anterior pituitary, we know lung 7 and kidney 6. हमने बात की थी कि anterior pituitary को, if we divide the pituitary into two parts, anterior pituitary and the posterior pituitary, the anterior pituitary is activated by the RAN-MI, means lung 7 and kidney 6. And posterior pituitary activated by the DO-MI, means SI3 and urinary bladder 62. Right? So if we are using these points, lung 7 and the kidney 6, they will balance the anterior plus intermediate pituitary both. So we can use in each and every condition. So lung 7, kidney 6 are good for skin, and SI3 and urinary bladder 62 are good for posterior pituitary.
Hello, sir. Then it can be used in butterfly pigmentation.
Yeah, definitely we can use it for all
Okay,
the
sir.
lung
Thank
7,
you.
kidney 6 we can use for butterfly pigmentation, hyperpigmentation, less pigmentation, white spot, vitiligo, चमड़ी का सफेद हो जाना या जरूरत से ज्यादा काला हो जाना, दोनों में हम इसका प्रयोग कर सकते हैं. ओके,
SI3 UV-62 BP में भी यूज करते हैं.
SI3 और UV-62 हम कभी कभी बीपी में यूज नहीं भी करते. इट डिपेंड्स कि अभी DU मेरिडियन का डिटेल हम डिस्क्रिप्शन जब पर हम बताएंगे आपको कि बीपी बढ़ा.
सर इसको टोन करेंगे लंग 7 और केक 6 को टोन और सेट.
Lung 7 tonify, kidney 6 sedate, right? Master point, couple point.
Right.
In white patches also we can use this?
Yeah, it's very good for white patches. Definitely we have to use it because for the white patches means, what is white patches? White patches.
Melanin is less.
Why the melanin is less? So we have to understand here, what is the meaning of white patches? We are telling it vitiligo, we are telling it leukoderma, right? There are many names.
Yeah, MSH is not produced properly maybe by the pituitary gland.
In the
Intermediate pituitary gland.
So MSH is produced by intermediate pituitary, but your immune system, your own immune system is attacking and damaging it, killing it. So there will not be enough melanin, not enough melanin. इसे कहते हैं ऑटोइम्यून डिसीज कि आपके इंटरमीडिएट पिट्यूटरी को कोई डैमेज कर रहा है. So that is called autoimmune disease. That's why leukoderma or white spot is autoimmune disorders. Yes, any question?
Lichen planus, sir.
Which one?
Lichen planus. Lichen planus.
Lichen planus also autoimmune disorders. We can use that.
Sir, what about dopamine deficiency?
For dopamine, it will come later on, because for dopamine we have to go DU meridian. So that thing we'll discuss. But right now, we are not discussing for this what we will do, for that what we will do, for that what we will do. We are discussing how we can use spleen 4, how can we use pericardium 6, because we have to develop the concept, not the protocol. The protocol will be made by you only. Our protocol खुद बनाए, right?
So acne vulgaris
For
में
example,
होगा
I will tell you this chart. Look at this chart. It's a very wonderful chart, and you can use this chart for many things. Let's see here.
So even in this coloration of the skin, we can use LU7K6.
Yeah. For any problem of this skin, we can use. So look at this chart. So for example, we are talking about any problem on the throat, like throat infections, chest, like the lung problem, or heart problem, and the lungs, we can use Renmai, right? Renmai. So in this way, we can use it for everything, which is in the chest. So most of the front part of the body, ये सारे front part के हैं. Front part. What is the meaning of front part? The meaning of front part is this. Look at this.
Hello.
If we look at this body, so this is the front part. And here, this is the back part. In the front part, we have face. In the front part, we have throat, chest, abdomen, front leg. In the back part, we have brain, गर्दन के पीछे का भाग, nape of neck. Okay, upper back, middle back, lower back, back of leg. In the front part, we are keeping anterior pituitary. In the back part, we are keeping posterior pituitary. And intermediate pituitary, we are keeping with anterior pituitary, intermediate. Now, the problem of the front part, we can treat with the lung 7 and kidney 6. And problem of the back part, we can treat with the SI3 and urinary bladder 62. Because the front part is controlled by Ren-Mai and the back part is controlled by Do-Mai. So now you're asking me that you want to treat the brain, you want to treat some problem of the brain, definitely you can use SI3 UV62. You want to work on the neck, upper back, middle back, lower back, back of the leg, anywhere in the back side, you can use Do-Mai, SI3 and urinary bladder 62. Especially regarding the brain, the multiple problem of the brain, we can work with SI3 and UV62, like Parkinson, multiple sclerosis, and many more other problems like we can use. The question is this, we have to think a little more about the tonification and sedation. We have to understand the pattern of the disease, and accordingly we will decide whether to tonify or to sedate, right? It is a simple classification. Front part, Ren-Mai, back part, Do-Mai. Okay. Now, very important information. We can divide the body. Any question more?
Sir, problems like ptosis, it is from the birth, it is also considered to be in the pituitary, or where it should be to put it?
Ptosis?
Yeah, ptosis.
Ptosis?
The drooping of eyelids, you know?
Ptosis
The drooping of eyelids.
Yeah, we will discuss that thing. It will be coming. But right now, I will tell you, you want to lift something up, we will be using Do-Mai and the Chongma. But this concept need little more explanation. Okay. So
Okay.
acne vulgaris and rosacea के बारे में वो ये जो 7K6 से होगा
LE7 kidney 6 से होगा, लेकिन ऐड करना होगा उसमें. We have to add something more, right?
So we excuse me. So we have front and side.
1 minute. Intermediate pituitary. Again, you are getting. Please don't get confused. Intermediate pituitary is coming with anterior pituitary. So what we are going to use? Lung 7, kidney 6. right? Intermediate pituitary, we are not keeping with the posterior.
So these points draw the energy from the kidney essence, or like how is it, sir? Okay, can we use them often?
EOV points?
No, these points like extraordinary vessels, no? मुझे like understanding है like they use the energy from the kidney essence.
See, right now, you have studied little more, so you are asking, but we have not discussed that thing till now.
So one
We
question.
are asking the question,
What
whatever
about
you
the
read from
sides?
other books, but we are not discussing that thing.
Okay. Okay.
Yeah.
So what about the sides? We have front and back. Sides.
Sites will be coming because, so for that, I will show you in one chart. So let me tell you something new, because you're asking the question which need more information, right? Okay. So first you see this chart, because even I shared in the group, but this is very important chart. Your question are very good. They need little more information, right? So let's discuss little more information. Okay. So this chart, actually I shared in the group and someone else also shared this group in the group. So if you remember this chart, it's a very important one. Okay, so we already have discussed this. You want to treat cervical spleen form. So this is a cervical spleen form. For the lower back, any problem in the lower spine, gallbladder 41. Okay. The problem in the right hand, lung 7, left hand, SI3. So problem in the right hand, lung 7, left hand, SI3. This chart we already have discussed. From the right leg, pericardium 6, left leg, UV62. Problem in the lower abdomen, kidney 6. So the very important chart. Now, this was the discussion. This was the discussion which we have done on the basis of previous knowledge. Now, just I will show you one thing. After showing this, I will. So now we are going to discuss three things, which is called three common energetic layers. Okay, three common energetic layers. You know, we have divided everything in three parts: heaven, human, and earth. Heaven, human, earth. हमने हर चीज को तीन भागों में बांटा है. Heaven is the uppermost part, superficial part. Human is the middle part, and the deeper part will be earth, right? So this is the deeper part. So deeper part, we are telling first ancestry, second ancestry, and the third ancestry. Please remember these names. तो हम हेवन को बोलते हैं सबसे ऊपर की या थर्ड एंसेस्ट्री, ह्यूमन को बोलते हैं बीच की या सेकंड एंसेस्ट्री, और अर्थ को बोलते हैं फर्स्ट एंसेस्ट्री. हेवन, ह्यूमन, अर्थ. Upper is heaven, middle is human, bottom is earth. So we can see here now. Here, earth is here, human in between, heaven in the upper part. The meaning of earth means Dumai, Renmai, and Shongmo. If we talk about the earth, the meaning of earth, Dumai, Renmai, and Chongmo. So earth means root, earth means very deeper thing. If you want to treat the root of the disease, अगर आप किसी भी बीमारी का रूट ठीक करना चाहते हैं, you have to treat Dumai, Renmai, Chongmo. Okay, so Dumai, Renmai, Chongmo is doing the carry forward our mother energies, और we can tell prenatal energy. हमारा जब जन्म होता है तो हम पेरेंट से जो ऊर्जा लेके आते हैं जिसे प्रीनेटल ची कहते हैं, that is carrying forward through Dumai, Renmai, Chongmo. So what I want to tell you, we can tell हमारे शरीर का रूट क्या है, हमारे शरीर की रूट एनर्जी कौन सी है, Dumai, Renmai, Chongmai. The root energy. Whatever we do the treatment, but in the last of the treatment we have to fix the treatment. हमने कोई ट्रीटमेंट दिया किसी को और ट्रीटमेंट करते करते हमारा ट्रीटमेंट कंप्लीट हो गया, लेकिन लास्ट में हमें रूट का ट्रीटमेंट जरूर करना होगा. हाउ विल डू द ट्रीटमेंट ऑफ द रूट बाय द Dumai, Renmai, Chongmai. Okay, this is a concept. Now if we are moving little up, अगर हम थोड़ा ऊपर जाएं, that is a human level. So it was the deep level, root level, that is the earth. Now we are coming in the center, that is the human level or the man level. In the man level, you can see here, one thread is going like this, one thread is going like this, one thread is going like this. What is the meaning of thread? Thread means who is connecting to a structure. धागे का काम क्या है? धागे का काम है कनेक्ट करना. धागे का काम क्या है? कनेक्ट करना. Right? So look at once again here. I will repeat this in a different way. So the energy of the Renmai is rising from here. The energy of Renmai is rising from here. The energy of the Dumai is rising from here. Right? Okay. Then what's happening? In between, we can see B-my. इनके बीच में हमें मिलता है B-my. So B-my is the middle one. B-my is the human. B-my is the man level. The B-my, B means connections, connecting. तो B-my एक वो चीज है जो ऊपर को नीचे से कनेक्ट करती है, हर चीज को एक दूसरे से कनेक्ट करती है. So now we can see this is the one line that is called yin B-my, and this is the another line we can see here that is called yang B-my. The meaning of B means connecting. So try to understand कि पहले हमने बात की बॉटम में हमारे 3 EOB हैं, Dumai, Renmai, Chongmo. अब इनको कनेक्ट करना है ऊपर से, तो कनेक्टिंग वेसल्स को बोलते हैं yin connecting vessel, yang connecting vessel. Connecting means WEI means connecting. तो क्या हुआ? तो कहते हैं कि in the bottom we have do channels, Ren channels, Chongmo. In the middle we have yin B-my and yang B-my. And remaining one on the upper level, heaven. अब जो कुछ बचा वो ऊपर रहा है. ऊपर क्या बचा, इसके बारे में हम समझेंगे. थोड़ा सा क्विकली मैं बता रहा हूं इस कंसेप्ट को. In the upper level we have yang cow and yin cow. Okay, this is the heaven level. In the heaven level we have yang cow and yin cow and dying my. Maybe I know that you are not understood, but quickly I will summarize this. We can divide all the EOB in 3 parts: Renmai, Dumai, Chongmo. In the center we have yin be my, yang be my. On the upper side we have yin quao, yang quao, and daimai. अब इसके बारे में हम कल बात करेंगे, है ना. दिस इज हेवन, दिस इज ह्यूमन, एंड दिस इज अर्थ. बस आप इस बात इतना समझ लीजिए, बाकी क्या है कैसे है विल डिस्कस टुमारो. सो लेट्स क्लोज द सेशन. अब हम कल मिलेंगे, कल मतलब परसों. इसके बारे में समझना पड़ेगा. वेरी वंडरफुल कंसेप्ट ऑफ द EOV, राइट. रूट, मिडिल पार्ट ऑफ द ट्री, जैसे एक पेड़ है, ट्री है, root of the tree, middle part of the tree, that is stem, and the leaves. So bottom is made by do my and my chongmo, middle part is be my, upper part is kwai and dai my. Okay, done. इतना समझ में आया. बाकी हम आगे बढ़ेंगे, समझेंगे. Thank you so much. Let's close the session. See you on the next class. Next class will be on Wednesday. Okay, thank you. Closing now.